Hi, everyone. Good morning, afternoon, evening, wherever you may be in the world. Thanks so much for joining us for our discussion, what European prescribing physicians want and need from life sciences companies. My name is Amanda Preto. I'm Vice President of Marketing for CMI Media Group. And we are about to get started on a very interesting conversation based on new research in partnership with Medscape and CMI Media Group, with lots of interesting perspectives from our prescriber and pharma marketing panelists today. So just a few notes of housekeeping. We are recording the session and the recording can be shared afterwards. We will be also sharing the report that this conversation is based on later in March following a few additional roadshows and client one-to-ones. So if you'd like a copy, feel free to drop your name in the chat. Otherwise, we will be proactively reaching out to you later in March. We're going to do some Q&A at the end of today's session. So if you do have a question, please use the Q&A track at the top of your screen in that bar. We'd rather not have it in the chat just so it's not lost. So please put questions in the QA. And with that, I am happy to introduce my colleague, Justin Freid, and get started on our discussion.
All right. Thank you, Amanda. And thank you, everybody, for joining us. And a special thanks to the great set of panelists we have today. Our goal today is to dive into what European prescribing physicians want and need from life science companies. So we've got a distinguished set of guests and experts that are going to share their opinions, as well as highlight some of the recent research that we executed in partnership with the Medscape team. So with that, let's do some quick introductions. I'm Justin Freid, Chief Media Officer at CMI Media Group, and we'll head to Matt next.
Cool. Thanks, Justin. So I'm Matt Durham. I am Director of Global Media at CMI Media Group.
Right. Since our fancy pictures are no longer there, I'll just call out some names and you guys can introduce yourselves. Michael, why don't you introduce yourself next?
Hi, I'm Mike Brandjeff, and I'm a Senior Vice President in the Medscape Global team.
Great. Jose Maria, why don't you head next?
Yes. Hi, everyone. My name is Jose Maria, but people know me as Chema, and I am currently working as Global Patient Experience Lead. But in my previous 18 years in the pharma industry, I've been working on HCP engagements and recently more on omnichannel transformation.
Great. And Dr. Fernando.
Hello, everyone. I'm Kevin Fernando. I'm a general practitioner, family doctor with specialist interests in cardiovascular, renal, metabolic, based in Edinburgh, Scotland, and also content advisor for Medscape Global and UK.
Awesome. All right. So as you can see, not only did we come prepared to talk about some great new research that we've been able to pull together, but also we brought a wide array of experiences and opinions to share with you. So we've got the agency side, we've got the supplier side, we've got the pharma side, and we've got the physician side. So hopefully you'll hear some unique things today that you can take with you and start using in the world of marketing that we all live in. All right, so let's dive in. One of the interesting things I think we saw from the end of 2019 into 2020 was a shift in media consumption behavior. We are now, due to the pandemic, we are now coming out of that where in some ways, things have returned to normal. So, Dr. Fernando, let's start with you. How have you seen the access for you, or let's rephrase that. How have you been able to be accessed by reps post-COVID? Have you seen things go back to normal? Are things different? What's going on in your world these days?
We are in a completely new era, aren't we? I want to see reps. I want to get that information. We've seen a rapid change, haven't we, in the pace of evolution of evidence, of guidelines. But my main challenge is workload. As we emerge from the COVID pandemic, patient contacts in my practice are at least twice that of before the pandemic. So time is my major challenge to see reps either in person or remotely, which is why I've been going a lot more to digital resources to access a lot of my information. So for me, the biggest challenge, it's not that I don't want to see reps, as I said, either remotely or in person. It's the time driven by my significant increased workload as we emerge from the pandemic.
Quite interesting. Okay, so Jose Maria, let's talk about the real world experience you're seeing from the pharma side and how you all are kind of changing the way you're approaching communication with healthcare professionals.
Yeah, well, the evolution was very clear because I still remember back in the day in 2020 when the whole reaction of the industry was like, what do we do now with the army of sales reps that we have sitting at home without visiting doctors? And I remember the conversations back in the day where, and the digital plans or multi-channel engagement plans back in the day that people started to share with me were more about trying to transfer what we were doing face-to-face to a digital environment. So saying we need to visit 8 doctors per day, remotely, etc. But there was a lack of understanding of what skills do we need to do that? How do we build trust with the doctors in a remote environment? Or do the doctors actually want to receive us in a remote environment, right? So that was like it took us by surprise. And but nowadays, if I look at the industry and how the discussion has evolved, now I think the discussions are more towards how do we understand different preferences of doctors? Because it may be that the doctors are there may be doctors who are more interested in speaking face to face for a specific reason, right? Like, for example, they would say, I wanted, if you're going to introduce me a new brand, then I'm willing to receive you face to face. But if you're just going to come to remind me a brand that we already talked about and we don't really have anything worth it to share, then maybe let's just avoid the face to face and have a remote conversation quickly. So I think it's and I see in general in the industry, we are evolving that conversation towards that model. Although there are still some things that we need to learn, right? So like if you have seen, sorry, I'm taking too long to respond, but one of the things that I have been discussing a lot in the way that pharma approaches engagement with doctors since the past year is we need to make a better effort to segment doctors and don't come up with the typical generic profiles of the innovator doctor, the data-driven doctor. We always do research to end up with the same profiles. So the more we understand those preferences at an almost individual level, the more we will be able to evolve that engagement and make it better in the future.
I love that because I think it actually touches on, one of the key themes that we uncovered with the research that we executed was the need to approach things in an omni-channel fashion. And, it's at its core, omni-channel is responsive media to how somebody interacts with a message, right? And that message could be a rep visit. It could be a digital ad. It could be an email. It could be anything. But taking it down and delivering kind of that unique journey, that unique set of content for that individual, how they're likely to respond. So we'll get into that a little bit later in more detail, but great insight there. Okay, so let's talk about, let's switch a little bit, and Dr. Fernando kind of touched on this. So we are starting to see, and Jose Maria, you kind of touched on this as well, but we are seeing in certain instances, digital resources be preferred over face-to-face rep visits. Now, it's not for everything, as Jose Maria just touched on, like, hey, maybe a new launch drug, it makes sense for face-to-face, but hey, reminder ads or reminder conversations may shift. So let's actually start with a unique perspective here with Michael. Michael, you obviously, with Medscape's prowess and size, you see a lot of ways physicians interact with content. Have you noticed anything unique about digital resources being preferred in certain types of behaviors or anything else?
Yeah, absolutely. I think all COVID did was accelerate that level of engagement, and I think Kevin touched upon this. That doctors in any healthcare system are increasingly time poor. So what does that mean? It means that increasingly you want to be in control of how you engage with that information. And again, Kevin's absolutely right. Doctors do want to engage with the industry. There's no doubt about that, but increasingly on their terms. And I think pharma need to recognise that there is an ecosystem outside of their owned channels. And I think if you can recognise that and build connections between first and third party platforms, then I think you're going to have more success in building those relationships.
Absolutely. Good points. Okay, so Dr. Fernando, you had kind of touched based on this, but anything to add about where you see value in digital resources versus maybe face-to-face?
Absolutely. Where I've found, I suppose I'm looking at from both perspectives as a practicing clinician, but also putting together some of these digital resources for Medscape. But any assistance for those at point of care prescribing decisions, for example, to save me a little bit of time, but ultimately to help improve the lives of my patients are invaluable. Again, I go back to the rapid change. If I use type 2 diabetes as an example, the rapid change in the evidence base in the guidelines, new classes of medications. So digital resources that help facilitate these quite complex now prescribing decisions at point of care are hugely invaluable. So the conversation might be started with a remote or in-person rep visit to tell me about a new drug class, a new drug. And then that journey can be continued, can't it, with a digital resource to complement that. You know, how practically can I prescribe this drug, case study based? So that's where I see there's a lot of interaction and a lot of synergy, of course, and a huge advantage to practicing clinicians like myself. And ultimately, as I said, it helps improve the lives of our patients in primary and secondary care.
Absolutely. Absolutely. And so that actually connects to our next topic really, really well. So obviously we've had NPP, non-personal promotion, out there. That term's been used for quite some time, and we've seen the term omnichannel, which is essentially connecting all of that NPP with personal promotion, right? We've had that kind of be the core of what many pharmaceutical companies are attempting to do for, let's say, the past 18 months to 24 months. Some companies do it well, others don't, but we know that it's kind of a way of being more effective with our communication. So let's start with Matt. Matt, from the agency side, how are you seeing omnichannel play a key role in how we're communicating brand messages to physicians?
Yeah, this is a good question. I mean, if we tie it to the research in the report that we built on, I think there's probably two parts of that. There's kind of two things that stand out. One is, I guess generally speaking, we know that the HCPs, they're engaging with lots of different channels, and they're doing so frequently. They're interacting with all the standard channels that we think of if we were creating an omnichannel campaign, right? The journal websites, the emails, the search engines, but then there's also just a much wider range of sources of information that they're going to, medical podcasts, medical videos on YouTube, for example. So we know they're not all congregated in like one or two places or one or two channels. There's so many other potential touch points we need to consider for them. And at the same time, kind of tied to that, the second part is that within this research we saw that physicians saying about how valuable different sources were, not just how often they're using them, but how valuable is a particular source for staying up to date on professional information. And there's a discrepancy there, not to kind of pick on the reps again, but I think within the report it's saying, generally speaking, about 80% of the HCPs were saying they saw a rep at least once a month. Whereas when we look at how valuable those interactions were, it was closer to 30% of them were saying that that's actually like a valuable or valued like engagement that they're having. So there's this gap there, and kind of when we're thinking of an omnichannel approach, like you mentioned, we have to be thinking not just about the channels, but also the value that HCPs are placing on those channels, and how we can make sure from an agency perspective is whatever we may be doing in that channels from an engagement or media perspective, making sure we're enhancing that experience that the healthcare professional has as they're trying to obtain new information there.
That's awesome insight, Matt. So Jose Maria, you obviously see things from a different view, and you've seen things across countries and specialties. Can you highlight a little bit about how you're seeing omnichannel differ or be successful, not as successful across various countries and or specialties?
Yes, I think it's different across the specialties with regards of, and again, I think the variables that I would say that make it different, it's the geography in terms of, for example, if culturally the country is much more open to digital versus another. For example, if I was actually looking at the report and I saw that, for example, Spain, it's higher in terms of the digital usage versus, for example, France or Germany, which again, it sounds, if you look at the cultural environment, for example, when I was working with pharmacists in Germany. I was working with developing plans for them. I learned that they communicate through fax, and yet we were planning of developing a website for pharmacists, and we were like, what's the point, right? If they are not. So I guess it's about the cultural aspect and the country aspect, the specialty aspect, because for example, some specialties I have learned that are much more open to wearable devices, for example, just because the industry has gone into that direction versus others. And then the other one, I would say it's probably also on the life cycle of the product. Like I said, if it's a very innovative product, this is going to also affect the way that the doctors can engage with you, because if it's very innovative, they're going to be always looking to receive you face to face or go to your congress, or even if you do it in a webinar, they're going to be there to get the latest research, right? Then I think my point is going into, we need to understand, we need to put it into the eyes of the moments of truth for the doctor, right? Because we cannot assume that the doctor is going to be always looking for our information or always thinking about, oh, how can I get the latest information about Sanofi's product, right? Or about anybody's product. They're not thinking like that. They're probably, they need to self-educate to stay up to date. And that's why they go to resources like Medscape or to get their most recent publications and the scientific education. And this is a moment of truth, because then if you can stay relevant in that moment, that is important for them, but that is also connected to your business outcomes, then that's your sweet spot. Instead of what I normally call the digital fatigue in doctors, I've done also some research on this, that the phenomenon was that instead of looking at those moments of truth, like Medscape, when the people are working, the doctors are looking for it, but rather I think pharma at the beginning was more like, let's push all the messages to the doctors and put everything into digital and, always on. And that created a tsunami of content, which is not okay.
Yeah, I mean, it's almost like we were overwhelming them with content. And I think it's an interesting thing to look at. And what we've kind of uncovered in our research, and as we've gone through and done more media plans in, the EU4 plus, plus the UK, and expanded into other countries and other regions. I mean, it really is, there's unique nuances with specific countries and then specialties in specific countries. But as kind of Dr. Fernando mentioned earlier, like each individual has their own media consumption behaviors. And that's why the omnichannel aspect, if omnichannel is functioning the way it should, the brand is there in the background when somebody's on Medscape or on another publication. And then when it is time to take action, they have that brand or they have that company in the back of their head, right? And then they go take action. Maybe that is returning an email from a rep to schedule that one-to-one visit, or going on to the brand website to get more information and download, a dosing guide. So it's about being there, being ready, and having that next action, that next message available should the HCP be ready to take the action. So I think that's where kind of like the omni-channel aspect is key for support for both the healthcare professional, but also getting that patient the treatment they need. So let's dive into one of the points I made a little bit deeper. Different countries and specialties have nuances. I know that's something in the report, Jose Maria, you kind of mentioned a little bit. Matt, this is something you and I have talked about as we got to dive into all of the data. Is there anything, Matt, you'd like to highlight specifically about the different nuances from country to country that you uncovered as you kind of mined through that data?
Yeah, there were so many differences in the nuances, so many different nuances. It's kind of hard to pick out a few, but I kind of very much agree with everything Jose Maria was just saying, especially from an agency perspective, it's so important for us to be able to understand and then plan accordingly to those differences that exist within the media habits from one country to the next, or from one specialty to another specialty. It's imperative. And I think the latter, the differences in the specialists, say the cardiologists compared to nephrologists, their habits, that's something that's kind of very much acknowledged, that there are going to be differences about how that happens. But I think potentially there's less thought sometimes that goes into, say, how a cardiologist in Spain is engaging with channels compared to their counterparts in the UK, or a cardiologist in Germany. And it can sometimes be a risk to almost think of them as kind of like a homogenous European audience, right? And they're not, you know, and I know that, you know, we just talked about kind of personalization, and this is potentially a couple levels above that, but there are these differences in how HCPs from the same specialty, but different countries are searching for information. And you kind of really have to understand what those look like to be able to create a campaign or content that encourages them to engage with it.
Absolutely. Good point. Jose Maria, you kind of touched on this in your last answer, but anything else to add regarding kind of difference in media consumption behaviors, whether that's at the specialty or the country level?
Yes, it's been something that has been on my mind, and I haven't been able to action it, by the way. Maybe it's a good point for inspiration for all of us, because when we are when we're looking for what content and what media the doctors are consuming, we need to treat them as consumers in the end, right? So we always hear that they consume different content, and yet whenever we go and we start finding information about what do they consume, it's more about the professional side. So there is not much on what content they are consuming, you know, that it could be related. Let me give you one example. I was having a conversation recently about this, very interesting. So I was saying, how can we actually identify if the patient, if, for example, a person is looking in Google for ways to get rid of mold in your walls, right, in your house, then there may be a lot of searches related to that can point you into the same direction that are not necessarily saying mold. Like, for example, renovating my kitchen, or tiles for my, you know, or a different floor, because they're renovating the house because they have mold. So this concept, I have been trying to replicate it in the HCP environment at some point, because if the doctor is looking for, again, depending on what kind of indication they're looking for, but if you think about a GP, right, that it's going to manage a lot of diseases, the type of searches these doctors are going to do are going to be very different to the searches that a cardiologist is probably doing, because of the breadth of the indications they treat, right? But then also the related searches connected to those needs are probably going to be different. So, and I'm bringing it to your attention, because at least me, I haven't been able to do it. The farthest I have gone is on keyword research related to professional services or professional environments, but not digging deeper into additional media consumption.
Yeah, I mean, so Jose Maria, I mean, so I don't know, you don't know this about me. I grew up in the search space. That was my first job, was doing keyword research. So you hit the nail on the head. That's something actually we do. We do a lot of here to understand kind of the different nomenclature used based on where someone is in a journey, an HCP or a patient, et cetera. So, I mean, that's something I think would be fun to look at and dive into, and would be some provide some great learnings. Dr. Fernando, I see you put your hand up. Did you have something you wanted to add?
Yeah, I just wanted to quickly add, I think we're all in agreement. One size does not fit all, not just by country, but also by specialty as well. An individual HCP, you know, as a KOL, I find I'm interacting more with MSLs now, a lot of valuable interaction, and looking for that sort of more, you know, medical, scientific, advanced content and digitally as well. So we very much have to bespoke these interactions, and maybe we can touch on this later on again, but social media is used so differently across Europe as well, isn't it? In the UK, we have a very strong UK med Twitter following primary and secondary care, but that's quite disparate throughout UK. Certainly, I know Spain has a very strong primary care diabetes online presence, a big group called Red Apps, which is great. So I interact a lot with these groups, but you know, less interactions in Germany, for example, on Twitter or LinkedIn, etc. So it is a very disparate array of interactions, and I think the omni-channel strategy has to reflect that.
Yeah, it's an interesting point. I know we talked about HCPs also being seen as consumers, right? And I think at least one trend we've seen in the US that we've started to see, you know, in some of the other countries as we've dove deeper into, you know, how patients are managing their health. While many will go to their physician and pick up the phone, there are others that are going to ask their friends or going anonymously into a forum to ask questions first before they even approach a healthcare professional. So it's important to understand what's going on in the social space, leverage social listening to understand potentially the questions that a HCP may be asked by a patient, so we can arm them with the content, the answers, the information to then go and have that conversation with a patient. So I know that's one thing we've done to help fuel the messaging we do for Omnichannel is use the patient social listening. So awesome conversation so far. I wanted to dive into something, and Dr. Fernando, you kind of mentioned this before, so I'll open with you.
Okay.
Preferences for different sources or channels for different messaging or information. You talked a little bit about the value of an in-person message for a launch brand. What else do you prefer? Like if you're doing continuing education, right, or getting up to speed on a new type of treatment, how do you approach that?
Well, for example, Congress highlights, big cardiology conference coming up shortly. Unfortunately, my wife hasn't given me a pass to get over to America for that one. So I look to social media, Twitter, because a lot of my colleagues are there. I get those key messages from the abstracts, from the presentations straight away, real time. And so that is for Congress highlights, social media is my go-to because of the immediacy. But as I sort of alluded to before, for those more complex prescribing decisions, I'll go to digital resources such as Medscape. I put these resources together myself, but I also consume them for those point of care access. Other digital resources, if I need to a deeper dive into new COPD guidelines, I might do a module, a longer, several hour module on a different resource. So my different resources are driven by the depth and immediacy of that knowledge, and that's how I make my decisions.
Awesome, Matt. I know based on what you're seeing from the media side, anything to add to that?
Yeah, I guess kind of within the report and the research we've done, at one point we're looking at the differences between HCPs, how they prefer different information, right, to receive information about different information, right? So at one point we're comparing how they prefer to receive information on new products versus existing products versus kind of formulary updates and changes. And there's absolutely a difference there. I think it was, for new product information, direct mail came up surprisingly high to me, at least, as a source that a lot of different specialties really wanted to kind of see that channel, and that was a great source for them. But something that really stood out was across those three different types of information was there was never really, for any one specialty or any one country, there was never really one or two channels that were like overwhelmingly popular for the entire audience. There was no like one source of information where we could say 85% of your GPs in Spain are going here, and therefore we have to use this channel, and that's going to reach the majority of your audience. Right? Instead, it was lots of different channels could say they were preferred by 50% or 45% of the audience, for example. The overall scores are much lower, which I think kind of ties into what we were just talking about, kind of the omnichannel kind of approach, right? We have to kind of think about more than just a couple of channels. We have to consider more tactics in the larger ecosystem, because just one or two is really not going to suffice with reaching, a sufficient amount of your audience.
Yeah, I think that's a really good point, Matt. And I'll actually, before the webinar started, Dr. Fernando brought up a great point that we're starting to see Gen Z come into play with those that are being doctors, right? So we're going to have a whole new generation coming in that has very different media consumption behaviors, channels that they prefer to digest content. So it's going to be a whole nother mess of ways we can communicate in a good way. But that's something that I thought, was a really great point, Dr. Fernando. Saw a quick question in the chat that I'll just pull up. So Ari, thanks for your question about GDPR. So yes, that is actually something, as we've been running our media plans across the globe, essentially. In every single country, there is not a direct mirror to what we have in the US in an NPI. But thankfully, there are, in many of the countries, there are unique governing bodies that do have some type of identification to be able to identify healthcare professionals, though it is not the same as NPI. One of the things we are doing, though, from a targeting perspective and a reporting perspective, is working with some of our supplier partners who specifically specialize in the identification of healthcare professionals, why they are online, to be able to deliver that level of targeting, both on an endemic website, but as well as just digesting content across the web. So more to come there later on. But yes, that's definitely something that it presents a unique opportunity for media agencies when it comes to performance reporting. All right, cool. So let's talk the next one here. Physician engagement, both with virtual and in-person conferences. So Dr. Fernando, you're killing this conversation today because you're touching base on a lot of this stuff. So let's start with you, and then we'll jump to Mike. You mentioned that you may not be able to come to the US for a upcoming cardiology conference, but you still want to digest some content. I actually loved the fact that you said Twitter, because that's one of the main things we do. It's like 3 days prior to a conference, we start promoting on Twitter ahead, especially for our clients that maybe presenting some new data readouts at that conference, to be able to also have a digital download that an HCP can have to read what's going to be presented. So anything else like you're seeing there, the value you get, Twitter, what else do you do if you can't attend but you got a little FOMO?
Absolutely. And this is something I do feel strongly about. As a KOL, I've been attending diabetes conferences in person for many, many years, a decade, and now with all the overlap, I'm attending cardiology, renal conferences too. And it's yes, there's the key learning, the key sessions, but the networking is so valuable, and that's what I've missed so much over the last couple of years. Yes, we've got some fantastic digital platforms, ways to consume these conferences virtually, but I've not yet encountered a way to effectively network online. We're social animals, aren't we? Ultimately humans, and that networking you just can't replicate online. But there's no doubt you can get those key clinical messages online on platforms such as Twitter. So it's two ways. I can't get to a conference. I look to my colleagues on Twitter. I do get to a conference. I tweet out messages. Tweetorials, of course, are increasingly popular. A great way to get messages out, both about a clinical topic and also congress highlights as well. So I think the hybrid world is, of course, here to stay. But for me, the networking in these conferences is so important, so valuable, and in my opinion, just cannot be replicated online.
Absolutely. So Michael, I know this is an area that you all at Medscape support a lot of different clients in. So what do you see from your end on the virtual versus in person?
Well, looking at the research, this is the one area that actually surprised me in terms of the results, and completely echo what Kevin says in terms of that networking. So I think there has been a bit of a COVID bounce in terms of the numbers of doctors who want to attend in person. Whether they actually do attend, we will see. But I think what we need to make sure though is that any information that's put out there for doctors or HCPs lives beyond that short window of the 3 to 4 days of that conference. And I think us as a publisher for sure, I think pharma as well has a duty to make sure that any advances in treatment or new breaking news and data that comes out of conference has to live beyond that window. And you've got to make sure that you get that content into the hands of maybe some of the junior doctors who maybe don't attend these conferences. And I think we've all got a duty to support that as well.
I think that's great insight. And I mean, there's different ways, right, of understanding who was at a conference and then delivering them a different message online if they were or weren't there. So great points, Michael. Cool. All right. So we're almost at the end of our conversation. Wanted to just, hand it to Matt. Matt, I know you spend a lot of time in the data. You had a couple things that you found unique that you wanted to highlight. So I'm going to pass it to you, to any other nuances you felt kind of stuck out that could be useful to the people that are here listening in.
Yeah, for sure. I mean, in the report, we'll see there's so much great information. There's so much interesting data that kind of backs up everything that's in there. So it's kind of hard to pick out 3 specific data points, or 5 data points to kind of say these are the key ones. But I will say some kind of highlights that kind of come out from that research, I guess, and we've touched on these in kind of to varying degrees in this conversation. But, a key one was the rep access that we initially started talking about, that historical trend for reducing access kind of continuing, and therefore the content has to be delivered across those multiple touch points. That stood out a lot. Again, a lot about kind of considering the big differences in the preferences across the countries and the specialties. And in with the report, I don't think we've really touched on it, but it also touches on differences in the age of the healthcare professional and the gender, which also has an interesting impact in some channels for sure. And then also, the types of content that HCPs are looking at causes a big difference in how they want to consume that information. And I think all of these points, they kind of, all of these, this all points to the importance of, a tailored approach, and just like as Mike was saying, not treating any HCP like the same. They are all individuals and there are differences that have to be acknowledged.
Good. Awesome insights, Matt. So with that kind of closes our scheduled set of questions. I will open it up. Amanda, I don't know if there's any additional things I maybe didn't see come in the chat.
I have not seen anything else in the chat.
Okay.
Anyone can feel free to drop a question into chat or QA. I can see both. You're also, I believe, able to unmute if you'd like to just speak your question.
I always say if there's no
Justin,
question,
I just wanted to make a quick point, Justin, if that's
Sure.
okay. Yeah, I think both publishing companies and pharma are hugely underutilizing social media. I think that is something. I mean, you're clearly a big advocate of things like Twitter, which is great, Justin. But I think there's huge progress to be made there for the industry as a whole and for the publishing industry as well. I think there's lots of untapped potential. I mean, you mentioned what I talked about earlier on with the younger generation, the Gen Z of doctors. They are using channels such as TikTok to access, medical information. So we need to be agile. We need to adapt to the changing generations of doctors and how HCPs look and consume medical education, as well as patient education as well. So I'd like to see a big drive and increased utility of social media going on from here.
I'm really happy you said that, Dr. Fernando, because I think that's going to be very interesting. So as we've kind of delved in and worked with more pharma companies, there's obviously the pure content play, right? But when it comes to media promotion, with the sensitivities around targeting paid promotion from a brand on social media to be able to verify that it's an HCP. That's been one of the hurdles we've at least understood from brands. But it's one of the areas we are directly working with some of our suppliers on identifying those HCPs for paid promotion when they are on a social channel. So definitely a big opportunity there, both from just a media consumption, if that's where they're going, especially those younger generations, to get them, but also the opportunity to bring the data and technology to serve the message to the right HCP. So that's awesome insight. So we actually have another question right directly for you, Dr. Fernando. So it says, as a physician, have you received more personalized comms structured around your preferences, online behaviors? And if so, what's an example?
Yeah, absolutely. I suppose going back to that example of Twitter and other channels, I'm searching for hot topics in CVRM, cardiovascular, renal, metabolic. So that drives a lot of content that comes to me. I'm often signposted or receive content about CVRM. So it does work. I do get that more sort of bespoke, personalized content online, and I like that. That works for me. I don't get me wrong, I get a lot of nonsense as well, as we all do on social media, but it certainly reflects my online searching, my content searching online.
So I will say, guys, this has been an absolutely phenomenal discussion. So I do want to thank Dr. Fernando. I want to thank Michael. I want to thank Matt. I want to thank Jose Maria for joining me here today and being willing to kind of talk through this. I think what we have discussed today is there's a huge opportunity for better communication from brands to healthcare professionals to ultimately serve those patients better. So thank you so much. If anybody on the line would like to see the report that we have referenced in kind of a pre-read before it goes public in a couple weeks, you can reach out directly to Matt Durham, who was the man spitting out all the facts and data points today on the phone call. His email's there right in front of you, mdurham@cmimediagroup.com. prescribing.com. So thanks everybody for joining, and thank you again to my colleagues. Have a great day, everybody.